There's a hidden truth about healthcare that most of us seniors just never hear. Every year, millions of us go for our checkups thinking we're doing everything right, staying safe. But what if some of those routine tests were actually pushing you toward unnecessary procedures, serious complications, or even worse? We are going to get into it.
So I really have to ask you, are your checkups actually safe? It's a huge question because some of the latest research is showing that sometimes the search for a problem is the problem.
And this number, well, this really shows you the scale of what we're talking about. Studies are finding that up to 37% of medical tests given to seniors can lead straight to treatments you don't need, complications, or even lifelong side effects. That is more than 1 out of every 3 tests. So let's break down the top 5 offenders, starting with number 5.
Okay, so at number 5, we've got the bone density scan. You probably know it as a DEXA scan. Now, it sounds totally harmless, right? It's just a quick, painless scan to check for osteoporosis, which is the condition that weakens bones. But here's the thing. After age 70, losing some bone density is, well, it's a natural part of aging. Kind of like getting gray hair. So these scans almost always find something, and that can kick off this whole cascade of fear and unnecessary medication.
Just listen to this story about Rose, a 76-year-old piano teacher. Her scan came back showing some mild bone loss. They call it osteopenia. Her doctor, boom, immediately put her on a powerful drug. And within just a few months, the side effects got so bad, we're talking severe reflux and jaw pain, that she couldn't even play the piano anymore. Think about that. The treatment for a number on a piece of paper literally destroyed her quality of life.
So let's just compare the approaches here for a second. On one side, you have these medications for mild bone loss that might reduce your fracture risk by less than 0.5%, okay? On the other side, you've got simple lifestyle changes like weight-bearing exercise and getting the right nutrition. Those things can cut the risk by over 20%. It's a much safer and way more effective way to go.
All right, moving on to number 4, and you'll see a pattern here. The brain MRI for mild memory loss. Look, when you start misplacing your keys more often or forgetting a name here and there, that fear of Alzheimer's, it's real. So a doctor will often order an MRI to see what's going on. But the problem is, these incredibly detailed scans, they rarely give you a clear answer. Mostly, they just show normal age-related changes in the brain.
And this number is just staggering. A huge study found that, 86% of these MRIs showed some kind of abnormality. A whopping 97% of those findings had nothing to do with any treatable condition. It's basically a false alarm that causes a ton of real-world panic.
And that panic, it has a real human cost. Take George, a 74-year-old retired engineer. His MRI report mentioned some white matter changes, which is basically just normal wear and tear for a brain his age. But hearing that something was wrong with his brain, it sent him into this spiral of anxiety. He stopped driving, he stopped going to his hobbies, he isolated himself, all because of a scan that just showed he was, aging. So what's the better option? Well, instead of jumping to a high-cost, high-anxiety MRI, a much better first step is usually a simple cognitive screening test. It's just a paper-based exam that checks your memory and problem-solving. It does the job without the risk of finding these harmless, age-related blips on a scan that cause so much unnecessary fear. Coming in at number 3 is a test I'm sure you've heard of. Maybe you've even had one. The cardiac stress test. It's super common when seniors mention they're feeling a little tired or have some tightness in their chest. The whole idea is to find blocked arteries, right? But for people who don't have obvious symptoms of heart disease, this test can be a real trap. And here's exactly why it's a trap. The false positive rate for these tests in adults over 70 can be as high as 40%. Let that sink in. That means that nearly half the time, the test screams serious problem when there's actually nothing wrong. And that false alarm, it sets off this domino effect of more invasive tests and procedures that you never needed. This is exactly what happened to Raymond, a 75-year-old retired postman. He just mentioned feeling a bit more tired walking up hills, so his doctor ordered a stress test, just to be sure. Well, that test came back a little fuzzy, which led to an invasive procedure, which led to a stent, then a bad reaction to the dye, and boom, a 6-day hospital stay for kidney problems. And the crazy part? His fatigue never went away because it was never a heart issue in the first place. A way safer approach for someone without classic heart attack symptoms is to just start with the simpler stuff. A resting EKG can check your heart's rhythm.
A coronary calcium scan can measure plaque buildup with way less risk of setting off a false alarm that leads down a rabbit hole of procedures.
Okay, you might be really surprised to see this one at number 2. The colonoscopy is, without a doubt, a vital screening tool. But, and this is a big but, for a lot of people after age 75, the risks start to outweigh the benefits. The PrEP alone can cause serious dehydration, the sedation is riskier for older adults, and the procedure itself can lead to some really serious complications. And the numbers, boy, they tell a pretty sobering story. For every 1,000 colonoscopies done on folks over 75, the research shows only about 2 lives are actually saved from colon cancer. But over 20 people will suffer a serious complication, like major bleeding or even a perforation of the bowel. That's a 10-to-1 ratio of harm versus benefit. It's pretty stark when you see it like that.
And this risk became very real for Dana, a 73-year-old grandmother. She had no symptoms, she'd had 2 previous colonoscopies that were perfectly clean, but her doctors still pushed her to get another one. They removed a tiny polyp, no big deal, right? Wrong. That night, she had intense abdominal pain, fainted, and it turned out she had a bowel perforation. She spent 9 days in the hospital and was just never quite the same again, all from a screening she almost certainly didn't need.
All right, we've made it. We are at the number 1 most overused and potentially dangerous checkup for seniors. Now, this one is often marketed to us as the absolute best thing you can do for prevention. But the science? Well, the science tells a very, very different story.
And here it is, the full-body CT scan. You see these private clinics selling them as part of these executive health packages, promising they'll catch cancer early. But the shocking truth is this: there is zero evidence, none, that these scans save lives in people who don't have any symptoms. What they do, though, is blast you with a massive dose of radiation.
And to give you an idea of how much radiation we're talking about, just think about this. A single full-body CT scan delivers a radiation dose that's equivalent to about 500 chest x-rays. 500! For an older adult, that level of exposure is not a small thing, and it comes with its own very significant risks.
In fact, the risk is so real that recent studies are estimating that the explosion in CT scans may now be responsible for up to 5% of all cancer cases in the United States. To put that in perspective for you, that puts these so-called preventive scans right up there with a known cancer-causing factor like drinking alcohol. A test that's supposed to find cancer is actually causing it.
One expert just summed up the danger of this perfectly with this quote: "It is a hunt for totally harmless, age-related little nodules and cysts that just triggers this chain reaction of panic, biopsies, and surgeries." It happened to a man named Marcus, 80 years old, felt great, but his scan found a tiny, benign little spot. The biopsy they did to check it out collapsed his lung, and he ended up in the hospital for 2 months, all for nothing.
So, what's the answer? What do we do? Well, a smarter path to health really comes down to 4 key steps. First, listen to your body. Report specific symptoms, not just general fears. Second, have a primary doctor you know and trust. Third, and this is crucial, always ask what happens next if this test finds something. And finally, just focus on prevention through your lifestyle. Stay active, eat good food, and get enough sleep.
So the next time a test is recommended, I just want you to leave with this question playing in your head. Is this test truly a safety net that's tailored for my specific situation, or is it just a wide net that's actually carrying more risk than it is reward? Remember, being an informed patient is your absolute best defense.